Good morning. My name is Stephen Thane. Welcome to The Political Mechanic. Today we're doing the third part of a series on how to improve the healthcare delivery system. The reforms taking place in public education offers a model for how to reform the healthcare system. For decades, families had only one option, their neighborhood public school. If it worked, great. If it didn't, too bad. But over time, Idaho began creating off-ramps or choices. First came private schools, then homeschooling became legal in the 1980s. Charter schools followed. IDLA opened online access to individualized courses. Advanced opportunities allowed motivated students to take college-level classes in high school, graduate early, and customize their path within the public schools. A hybrid home education public school system now serves roughly 17,000 students. Most recently, HB 93 added tax credits. So what's the common thread? Parents were given options, and those options are reshaping the system organically. When you allow choices, families themselves begin to reform the system. Lawmakers don't need to engineer the final outcome. They simply need to create legal space and then allow students to act. Today, roughly 30% of Idaho students no longer attend their assigned neighborhood school. Around 100,000 students are in private, homeschool, charter school, or other alternative models. So why does this matter? Because liberty, or freedom of choice, is the foundation of America's limited government tradition. Systems improve when families are free to choose what works for them. For too long, public education operated as a one-size-fits-all model designed by experts. And the same is true in healthcare. Central planners have attempted to engineer uniform solutions for millions of unique individuals. But human needs are not uniform. Education isn't improving because we're pouring endless amounts of money into one delivery system. It's improving because we created options. Healthcare reform can follow the same pattern. As long as government locks people into one expanding structure, costs rise and accountability falls. Real reform requires off-ramps. And one of the first steps is repealing Medicaid expansion. Now, to understand why, we have to understand what's broken with the system. Our current insurance model, including Medicaid, is designed to finance treatment for after damage is done. Hospitalizations, advanced testing, surgeries, lifelong prescriptions. It does little to encourage prevention before these costs occur. Yet nearly 70% of healthcare costs stem from lifestyle-driven conditions: poor diet, inactivity, substance abuse, unmanaged chronic illness. The system rewards intervention after decline, but not stewardship before crisis. There's also a deeper issue, the proper role of government. Civil society should help people become self-reliant, not permanently dependent. Laws should align with natural consequences, encouraging responsibility, not shielding able-bodied adults indefinitely from the results of their poor choices. So here's a different approach that creates one possible off-ramp. Idaho currently spends about $90 million per year on Medicaid expansion for roughly 90,000 mostly young working-age adults. The federal government contributes another $1.2 billion. Instead of spending $900 million, let's take 72 of the state's share, save $18 million outright, and provide each eligible adult $800 per year for up to 3 years, a lifetime limit. This is not hospital insurance. It is access to primary care. It'd pay for 4 or 5 visits per year. For young, generally healthy adults, that's where the focus belongs. Create a lifetime limit, stabilize the budget, shift incentives toward prevention and responsibility, Then we could sweeten the pot by asking Washington for a waiver to redirect $350 million of the federal funds to fully cover approximately 20,000 pregnancies annually and to fund health coaches for those in this population facing serious chronic conditions, so prevention and accountability become part of the system. That proposal should appeal to federal policymakers as well. Idaho would reduce federal spending by roughly $950 million, while demonstrating a reform model that other states could replicate. That moves us away from hospital-based sick care and toward prevention. It stabilizes spending, restores incentives for work. It invites communities to step forward. Thank you for your time.